I've been looking forward to this day for quite a while. I know we're going to have a lot of very important discussions about arguably the single most important ingredient of our success in integrating health on the UNFCCC agenda and resourcing countries that desperately need financing to build climate-resilient health systems. As you all know, putting health at the center of the climate agenda has been a long-standing goal for many, many stakeholders in our space, and it's something that Forecasting Healthy Futures has looked for ways to contribute to as well. Over the last couple days, on several occasions, you heard mention of the COP presidency's Continuity Coalition on Climate and Health. This was the very important multiple COP presidencies coalition that was launched in Baku last year. And so today I thought what we would do, since many of you have maybe seen the launch, maybe you were in Baku or you watched that online, or maybe you've been sort of waiting to hear a little bit more about how the Baku Coalition will continue to build on the momentum that began way back at COP26 in the UK, reached a sort of pinnacle with the Health Day in Dubai in COP28, and then was really moved along by the COP29 team. So with that, I'm happy to introduce panelists once they're up. This is a very, very unscripted session, and there's going to be time for questions. So I hope you'll keep that in mind and have your questions ready. And in fact, who do we have here? Wonderful. So first of all, in order that I see them on the screen, Dr. Maria Neira from the World Health Organization. Most of you are probably very familiar with Maria. She's really been the face of climate and health for some time now. So we're very pleased to have you here, Maria. Welcome. And then I don't have the images up now, but I did see Mr. Elmar Mammadov, who is the representative from COP29. He's part of the COP29 presidency team and was really the architect and the founder of the Baku COP presidency's Continuity Coalition on Climate and Health. So welcome, Elmar, if you're still here. I can't see you at the moment. Also online, do we have Mona Ashur? Hold, please. I don't know if the panelists have audio and can maybe let me know if they can hear me. Also, I know with us, and I'm sure we'll get this straightened out in just a moment, is Ambassador Alexandre Ghisleni, representing COP30 here in Brazil. Ambassador Ghisleni is a diplomat. He serves as the head of the Special Office for International Affairs at the Ministry of Health here in Brazil. He plays a leading role in the COP30 team's preparation for Bele later this year. And he's actually been very focused on efforts to align environmental, biodiversity, and health objectives across international platforms. So really the perfect person for us to be speaking with after a couple days of talking about how exactly we do that and what that means to integrate the Convention on Biodiversity, the Convention on Climate Change, the Convention on Combating Desertification, and make sure that health is the uniting objective of all of those platforms. So welcome, Ambassador Ghisleni. Very nice to have you here with us.
Thank you very much.
And I think I see online Dr. Mazen Alkavi. Is that you?
Yes, good morning.
Hi.
I'm attending. Hi, how are you doing? Good?
It's very nice to have you with us again. You joined our summit last year, and I imagine you're stepping in for Dr. Hussein, and that is wonderful that we have a representative from COP28. Keeping in mind that COPs 28 through COP30 have worked so closely together as a troika to ensure continuity on a number of fronts, but including on the health front. And that's, of course, what we're here to talk about today. So it's exciting to have all of you together. Thanks for making it happen on short notice. Looking forward to this discussion, and I've just told participants in the room and online that we'll save some time for Q&A, so I hope that's all right. Wonderful. Mr. Mammadov, can we start with you? I didn't give a lot of background on the Baku Coalition, but it has come up in conversation with representatives from the COP30 team here over the last couple days, and it's been wonderful to hear that that is so central to COP30's planning. But looking back to a year ago, 18 months ago, would you share with our participants what was the inspiration for the coalition and how you managed to get all of the COP presidencies on board to create this multi-COP presidency body?
Good morning. Thank you very much for inviting me to this important event. Last year, I remember during the summit of Focusing Healthy Futures, I remember I was on mission and received invitation to attend this event in Baku. And originally, it was planned to have Troika at this event. It was originally Kelly proposed me to have United Arab Emirates, Azerbaijan, and Brazil. And my proposal was that, taking into account that Climate and Health Initiative originally in Climate Action Agenda started in UK from Attach Initiative, and also it continued in Egypt with ICANN declaration. We need to have also UK and Egypt on board and to have continuity coalition. And why continuity coalition? Because during our consultations last year with all stakeholders, with UNFCCC parties, non-party stakeholders, including civil society, international organizations, multilateral development banks, multilateral climate funds, it was expressed one concern, and because we wanted to understand and also to tackle global gaps, one concern that there are no continuity and complementarity between COP presidencies' initiatives. That's why this idea also was born at the Focusing Healthy Futures similar session last year, jointly with WHO, jointly with Dr. Maria Neira and Marina Kelly. We had a hybrid session with continuity coalition members, and then we discussed to establish this continuity coalition. And I would like once again using this opportunity to express gratitude on behalf of COP29 presidency to all members of continuity coalition, UK, Egypt, United Arab Emirates, and Brazil, also WHO for accepting this initiative and also establishment of this important coalition. In Baku, actually we had because as we all know, first ever Health Day, it was organized in COP28, and also first ever declaration on climate and health. It was also established, created in Dubai by COP28 presidency. In Baku, we continued this tradition. We organized Health Day. Formally, we had one Health Day on 18th of November, but actually we had 3 Health Days, because on 18th of November we had Health Day, where we launched also human development for climate resilience, where health was one of the key elements. And also we signed a document for establishment of Baku Co-Presidency's Continuity Coalition. On 19th of November, we had Food, Agriculture and Water Day. And during that day, also we organized high-level ministerial roundtable on One Health concept. Again, we addressed synergy between food agriculture and health. And on 20th of November, we organized also Urbanization Day. During this Urbanization Day, we launched important initiative, multi-sectoral actions pathways to resilient and healthy cities. By this way, we brought together 2 very important topics at the global climate agenda. On the one side, climate and health, on the other side, climate and cities. its first ever declaration, MAP declaration, multi-sectoral actions pathways to resilient and healthy cities, which integrate health also into this initiative. Next week on Monday, we'll organize jointly with colleagues and friends from other co-presidencies, from previous co-presidencies, first hybrid also continuity coalition, because we have two continuity coalitions, one on climate and health, second one on urban climate action. And on urban climate action, again, we have very strong health element. Next week we'll organize jointly with UN Habitat and WHO in Geneva important briefing for diplomats on this topic. And using this opportunity, I would like also invite focusing healthy futures and also other participating country stakeholders to endorse also this declaration, to join to MAP declaration, because next year also Baku will host World Urban Forum 13, WUF, where we would like again to continue, integrate and prioritize health topic. We are working very closely with our friends from Brazil on COP30. I now, my colleague Ambassador will brief you on climate and health action plan. We are now planning to organize also, we already organized 3 online meetings of coalition on climate and health, and it will be organized first offline a meeting of Baku Co-Presidency's Continuity Coalition within the framework of World Health Assembly in May, on 21st of May in Geneva. We are keen to jointly to promote this topic and also to mobilize also climate finance on this topic. As you know, COP29 produced very important also outcome on new NCPG, at least 300 billion annually until 2035. It's the first track, and second track is also Baku to Bele roadmap to 1.3 trillion. So, and we are now also trying, I am co-chairman of the COP29 Action Agenda Initiatives team. As a co-chairman of COP29 Action Agenda team, we are trying also integrate several our initiatives which could serve as a platform to mobilize also climate finance. And one of them is Baku Initiative for Climate Finance, Investment and Trade, where again climate finance for health could be also play important role. In other words, I would like just to highlight that all these thematic days in COP29 on 18, 19, 20 in November, and also all these initiatives, they complement each other. And we would like to work jointly with all friends and colleagues from COP26, COP27, COP28 and COP30 presidencies to operationalize all initiatives and also to complement each other's initiatives on this important topic. I would like to stop here, and if it will be any questions, I am ready to respond. Thank you.
Thank you so much, Elmar. I'm sure there will be questions on that, but thanks for sharing not just sort of the origin of the Continuity Coalition, but what you've been working on and toward. Forecasting Healthy Futures, of course, would be very proud to endorse the resolution you mentioned during the World Health Assembly, and we can help bring together the stakeholders through our network, which include private sector players and NGOs and civil society organizations. And I should have mentioned earlier to our panelists, we have some 300 people tuning in to this talk now. About 100 of them are here in Rio de Janeiro, and the others are participating online, representing more than 200 countries, 200 organizations, in 45 countries. So this was a great opportunity to put those plans out there and to make sure that we can support and amplify the resolution as much as possible. I also just was thinking, COP28 in Health Day in Dubai was a really necessary focal point, and it generated so much momentum and new initiatives and a lot of the encouraging progress that we're seeing on the health front. But what you did and just described, Elmar, is really sort of diffusing health throughout multiple thematic days. And I think that's an important direction and very consistent with the conversations we've been having over the last 2 days, where we really don't see building health as another vertical, right? We really are thinking of health as an outcome that spans multiple verticals, disciplines and sectors. So that's interesting for us to think about after the conversations we've had the last couple days. Dr. Neira, I'd love to turn to you. The World Health Organization serves, your department actually serves, I think, as the secretariat for the Baku Continuity Coalition. You took that on during a very busy time. I know that you were in the progress of prepping the Climate and Health Resolution for the 77th World Health Assembly, which was adopted. Congratulations again. And then working toward building the associated action plan, which having been part of some of the consultations, I understand what a huge role that was. So maybe you can talk about why, in the midst of that very busy time at the World Health Organization, you still made the time to support the Baku COP Presidency's coalition, and why you thought it was so important to do that.
Thank you very much, Kelly, and so happy to be back at the Baku Spirit, even if it's only virtual, and to see as well the faces of all of those who have been so much engaged, so much committed, and I know that COP30 in Brazil will bring again an incredible spirit. Kelly, being on a hectic time in WHO is not something that we are afraid of. At the contrary, we like to be very much busy. We like to have a World Health Assembly resolution. We will love the countries to approve the global plan of action, and I'm pretty sure it will be the case. We have been engaging on different negotiations.
Maria, we're losing your audio a little bit, and you're frozen on screen. I can see you're moving around a bit, but do we need to come back to you? Okay, I think we've lost Maria. Hopefully we get her back. But I did like that comment that she just made about, this kind of busy.
And movement.
Oh, you're back now, Maria. We had lost you for a minute there.
Sorry, I was saying that to prove that we are a movement, I'm on a train to demonstrate that. But I suppose this is not helping very much at the moment. I wanted to say that at this time, the word coalition is a beautiful one. The one that we need to use very often, the one that will provide us this continuity, this power and motivation to do more. As WHO, of course, we are extremely happy to be the secretariat of the coalition to help on that, to maintain this very powerful health argument for more movement, for more excitement, and hopefully for delivering much, much more. I'm not sure I'm still connected, so maybe just ensuring that you can hear me, if you can say something, or yes?
Yes, we can
Fantastic.
hear you, Maria. And we heard you say that that this kind of busy is good because it means health is making its way onto multiple platform agendas. And we heard you say that coalition is a beautiful word. And of course, we've been talking about that a lot. We can't do any of this alone. And so wonderful that you all are working together on this front. And thank you for joining us while in transit.
If you allow me,
yeah,
there is another word I would like to add, which is that more than ever, we need to be cost efficient. We need to produce results and tangible, impactful recommendations and interventions for our people. And I'm very happy to report that this is maintained, this is the case. We are all very much motivated to keep action on protecting our citizens from the consequences of climate change and health. And for that, I thank you very much, all of you, for organizing this meeting, and of course the members of the coalition, because they are playing an incredible role on maintaining the interests and the commitments alive. Thank you. Back to you.
We're losing you again, but we heard that comment, Maria, and thank you. We couldn't agree more. And you know, that is sort of the elephant in the room that hasn't come up often, but resources are constrained on the global health and development front. And we do need to look for cost efficiencies on the ground, as always, but also at the global governance level. And it's actually one of the things that we're highlighting during this summit is the idea of the Rio Trio initiative, and that the World Health Organization shouldn't have to manage climate and health, or biodiversity and health, or desertification and health agenda with 3 different framework conventions. Let's bring those together, simplify and streamline things, because the health outcomes are the goals for all of those frameworks. So thank you so much. Hopefully we can come back to you too, Maria, with some questions. But I'd really like to turn it over to Ambassador Alexandre Ghisleni. Ambassador, thank you so much for joining us. We've had the pleasure of hearing from Dr. Agnes Suarez da Silva. We had Dr. Paulo Gadelha come and speak to us on the Fiocruz Climate and Health Agenda, which was fascinating. We had Dr. Daniel Boos with us yesterday as well. Maria, I mentioned he's somewhat your counterpart at PAHO. But we are still eager to hear more about the plans to integrate health on the COP30 agenda, how you will use the Baku coalition. We have all seen little peeks at the Bele Health Action Plan, and we're so happy to see that health is being prioritized very thoughtfully and inclusively. How do those two things interact, if at all, the Baku COP presidency's continuity coalition and the Bele Health Action Plan? And how should we expect to see those interacting in the lead up to and at COP30 on Bele?
Good morning from Brasilia. I hope you can hear me well. Thank you for the invite and thank you for the questions. And also send my thank you to my colleague Mammadov for his comments, which have made my presentation easier. Let me address your question. How do they interact? We believe that our initiative in COP30 is a logical development of what we have been doing throughout COP since Glasgow. We have launched a patch, we have stated a number of ideas through declarations in Sharm el-Sheikh and in Dubai. In Dubai, we reached a very important number of over 140 signatories, if I'm not mistaken. And the Baku presidency helped us organize the way that we can push a follow-up on these issues. So it came to our mind that it was time to provide means to have some more concrete action on this area. We have laid the ground for action, and now we have to go down a path that we actually view this whole initiative as an important step forward in a trajectory, in a path that we have to go down together. So, what is it that we mean by this a plan of action? As we all know, and we talked. I mean, the international community had extensive talks in the last few years about financing, which needs no introduction. It goes without saying. We thought it was high time we answered the question: what is to be financed in the health field when it comes to the adaptation of the health sector to the effects of climate change? And this brings this issue closer to home to many people. And we understand that adaptation has always been an important issue, but it has never received such an amount of attention as it will in Bele. So this is the whole issue for us. In order for us to keep the momentum and to go, I think, and to pursue the ultimate goal of adapting our societies and living in a world without where we can fully adjust to the effects of climate change and control it. Health has to be a part of it. And it can surely be if we can define the actions that ministries of health are supposed to take. And so this is an important initiative in that we are, of course, we are involving all major players in this field, but we are focusing on actions that can be actually taken by ministries of health within their portfolios. We want to bring together a coalition of the willing of countries that are interested in moving ahead in this issue. We hope that we can have as broad a support as possible in order to make it a meaningful action that can make a difference in the future. What you have to say, what you have to agree to in Bele is how we can jointly adapt our national health systems to the effects so that we can make a difference in people's lives in the coming years. So this is an ambitious attempt. We know that it has not been attempted before. But we are very much confident that it is feasible, it's doable. We believe that there is a broad margin of consensus around this area, at the very least among ministries of health, so that we can make it turn into action in coming days. And what's the role of the coalition in all of that? It's not. It does not only relate to the past. I mean, to the action that has been taken in the past few years. We hope that the coalition, the Baku coalition, will continue work in order to push for follow-up and push to deepen this conversation and to add more elements to it. With the addition, of course, of the new presidencies that will come in the future years. So it was a very meaningful step that we took last year, and we are serious when we say that the legacy that we want to achieve in Bele is supposed to be a lasting one that can actually help us move in a coordinated way towards a better future for all of us. That's the thrust of it, but I would be glad to take any questions, should there be any. Thank you.
Thank you so much, Ambassador. Yes, we all appreciate that the Bele Health Action Plan is very action-oriented, very focused on articulating those health sector adaptation opportunities for investment and really pushing us to a point where we can be more specific about that. Here at the Forecasting Healthy Futures Global Summit, on the first day, we spent all day talking about sort of adaptation innovations. But we also talked about the fact that we need better ways to measure a baseline, to be able to quantitate the resilience of health systems, and that ties to your point about at least ministers of health understanding what those adaptation investment opportunities are and moving, so that we can move from just this awareness that we have created to action. And I love what you just said about the coalition members reinforcing what COP30 does this year in the lead up to Bele and really leaning in to support that work in the health sector. And maybe that's a good way to bring you into the conversation, Mazen. I'm interested to hear, since December 2023, the 3rd, I think, was Health Day. What has the COP28 presidency, legacy presidency, and the United Arab Emirates done to maintain their leadership position at the intersection of climate and health? And how does that feed in through the Baku Continuity Coalition, as the ambassador just described, in support of the Bele Health Action Plan?
Thanks. I hope you hear me.
It's a little quiet, but we can hear you.
Yeah, we have with us Dr. Moza Alkteb from the Ministry of Health online, and I think she would be representing Dr. Hussein Al-Rand, and I will be happy to complement whatever she is going to say. Dr. Moza, do you hear us?
Maybe we can promote Moza to the panelists' screen. Right now, I cannot see or hear her, Dr. Mazin.
Yeah, I see her as among the participants, but Dr. Moza, do you hear us?
Maybe while we wait, we'll come back to you. Hopefully, Dr. Moza will be able to join. I don't know if there's a problem on our end, but I'm sure if there is, we're working on that right now. But maybe we can just come back to you, Elmar, to respond to what Ambassador Ghisleni just said about the coalition serving to reinforce this movement toward actual investment in health sector adaptation to climate change, and actually how much the Baku Continuity Coalition will engage on that front, on the investment front. Is there a role for the Baku Continuity Coalition in acknowledging and motivating new commitments and tracking those commitments over time so that we can learn from the experience? Or will we be focused primarily on advocacy and exploration of adaptation? Maybe you could just speak to how you see the Baku Continuity Coalition figuring into that.
Thank you very much for this question. I think that we established Baku Continuity Coalition between co-presidencies. First of all, as Dr. Maria Neira also highlighted, when we are together, we are stronger to promote all these topics. Second, I believe that in the coming years and maybe in the nearest future, Baku Co-Presidency's Continuity Coalition could be established some new formats like Continuity Coalition Plus by participation of investors in this sector, and also for mobilization of investments in serve, definitely. First of all, for mobilization of global climate finance to this sector. One thing that co-presidency alone write letter and promote and mobilize climate finance to this sector. Completely other case when 5 co-presidencies are writing this letter or promoting together. And I believe that after COP30, also future co-presidencies could join to this coalition, could be part of this coalition to promote together. But I think that Baku co-presidency's Continuity Coalition could play an important role during the designing process of Bele Action Plan and also for mobilization of investments to this sector. We are, as a COP29 presidency, last year also established Rio Trio mechanism. You mentioned already this Rio Trio mechanism also could serve as an important platform for mobilization. And again, I mentioned that we brought also last year first ever health topic to the cities level, taking into account that urban development and cities topic is one of the hot global topics on climate and health, I believe we can also efficiently use this platform. And now we are promoting, aligning also two processes. One process from COP urbanization process, because last year in Baku we hosted also third ministerial meeting on urban development, and next year it will be WUF World Urban Forum. We are aligning also these two processes. Again, private sector also will play important role, and I think that health should be one of the key sectors in both coalitions' activity. This is very briefly. I wanted just to mention these points. Thank you.
You know, that's very helpful, Elmar. Thank you. And you mentioned two things I just want to comment on quickly. The Rio Trio initiative, yes, of course, Azerbaijan, as the presidency of the UNFCCC, made that announcement alongside Saudi Arabia and Colombia as the executive secretaries of those conventions. And there's so much there. And our participants here at the Global Summit are really eager to support that integration work and bring it down to the national level. And we've been talking a lot about that. Of course, that's not the topic of this call, but we'd love to follow up and see how we can support the Rio Trio initiative, which is so important. But you also mentioned, of course, financing. Today, our joint symposium on climate finance for health is co-hosted with the Asian Development Bank. Of course, ADB has been really playing a leadership role in looking for new ways to make financing accessible to vulnerable countries for health sector adaptation. And we also have some great representation from the private sector and have been talking about ways that they could be more involved as their investments and their core businesses are more aligned with our health objectives. So just something else to think about. I love what you said about the Baku Continuity Coalition Plus, and maybe there's a private sector component of that that could support the COP30 team through the coalition. I think we have Dr. Moza now, at least audio, so we'll be looking at you, Dr. Mazen, and hearing from Dr. Moza. But it's a good time to check in on the United Arab Emirates, the COP28 presidency. How is climate and health still a part of what you're doing at the global governance level, how you show up in these multilateral frameworks? Tell us a little bit about what it's been like since December 3rd, 2023.
Yeah, thanks a lot. You know, I've just wear the hat of the Ministry of Health of United Arab Emirates after so many years of working with WHO. But I know the situation from the WHO position, but I know also the situation from the Eastern Mediterranean region, hosting some of the developing and least developed countries. And as I can say it, United Arab Emirates is very proud to be part of the international work actually on climate change and health since the early ages of the first COP talking about climate change and health. And the COP28 declaration was really something that we would like to see and implement it in the future. And we are working with our partners through the Alliance on Transformative Action on Climate Change and Health and attach with WHO and with the Baku Coalition to make sure that agreed action that we agreed in Dubai will continue to be with us for the years to come. We fully agree that finance is lacking for some of the countries of the world, but I want to reassure that technical capacity is lacking as well. We shouldn't forget that, you know, the ministries of health in several countries of the world needs further support to better understand the adaptation, how to measure the baselines, how to measure the indicators. Some of those countries are still struggling with using the tools, and I think the WHO effort is continuing but need to be intensified. We shouldn't only focus on finding resources, but also making sure that the technical capacities, tools, and systems are available, and staff of the ministries of health in those countries are capable of using this, particularly when we talk about information, using information, linking the health information with the climatic forecast, the modeling. I'm sure this will be on the agenda of the Brazil, so big meeting. We will further discuss this. I think Dr. Hussein Al-Randa and the team from the Ministry of Health will be participating in the side event during the Health Assembly in Geneva in May, and also in the meeting in July in Brasilia. And we will further shape, in collaboration with the other partners, shape the agenda of the COP30. But I can assure you of the full support of the United Arab Emirates on work on climate change and health, whether globally or regionally or at the national level. Back to you.
Thank you so much for that. One of the
I
things
would like to say hi as the
hi.
mic and the camera is open now. This is Moza Alkteb from the Ministry of Health and Prevention in the UAE.
Hello,
And
Moza.
I emphasize on the words that said by Mazen, Engineer Mazen, and we assure our support and continuous support with you and in the coalition and in the COPE activities and engagement. And we need to address also effectively about the climate crisis, that we must adopt the integrated approach between us all to continue the climate action on health and on focus to be focused on some policies that will help on that. So we assure the support of UAE in such engagement and such approach on climate and health. Thank you so much for the discussions.
Thank you, Moza, for joining, and thank to both of you for giving us the perspective from COP28/UAE. It's kind of proof that this coalition can work, that you're all talking together and moving in the same direction. I don't love, but thank you for pointing out that there's a financing gap. We're focused on that today, but there's also a knowledge and capacity gap on the ground in ministries of health, and not just in those most vulnerable countries, really everywhere globally. They're on the front lines, some of the low and lower middle income countries, and feeling the most impact of climate, and that sort of needs to be a learning ground for us to find effective adaptations and understand what works and what constitutes resilience. And you mentioned early warning systems and disease planning, data and AI capacity. We have a panel to talk about that later today, but it does feature very squarely in the Bele Health Action Plan. And so, Ambassador Ghisleni, maybe you could say a little bit about that, about data, early warning systems, AI, why it's elevated to that level in the Bele Health Action Plan. And then Maria, I'd love to hear from you in the couple of minutes we have left to say, how are you helping to get those capacities and adaptation strategies that are being refined and put forth and operationalized here by the COP30 process? How are you helping to get that to ministers of health and help them absorb that? So over to you first, Ambassador.
Okay, thank you. Thank you very much. It's a very complex question with a very easy answer. Well, maybe easier to say than to do it, but in any case, the way we view it is this. We had the mission of strengthening our national health systems and making them resilient in face of pandemics in any case. We are in a new area. A new pandemic may come at any time. I don't mean to break bad news or the participants, but that's the truth. We just don't know when. So ministries of health already had the mission of enhancing their own national systems to a new reality. And in order to achieve that, we have to use a number of tools. Artificial intelligence, strengthening of the health workforce, a number working on health infrastructure. It's a multifaceted challenge, multifaceted task. What we are saying is enhancing the resilience of the climate, of the national health systems would be pointless if we didn't make it in a sustainable way, which means in a way that can already adapt to face the effects of climate change. So we are bringing these two challenges together. We want to use the technology that we were going to use anyway to improve our national health system in order to make it adapted to the effects of climate change already. So we have two challenges ahead of us. They are both simultaneously important, and what we are proposing is let's merge these challenges, make it one, and then one that we can face in a cohesive and coherent way together in the coming years. This is the general philosophy over it. Thank you.
Thank you so much, and just please know that you have a lot of support for that work among our summit participants, and we'll be providing sort of a summary and synthesis of the conversations over the last few days that have really touched on those issues. So thank you for that leadership. Maria, very quickly, in just a minute or so, what does that mean sort of on the ground in countries that rely on your support for capacity, guidance, and development? Are you with us or frozen? So, Maria may be frozen now. Do we have any questions from participants? For our panelists' knowledge, we ask participants to submit questions through the app and not raised hands here in the room. So I'm wondering if there are any queued up for us. All right, hearing none, I'm going to ask my own. So we've talked a lot now about the landscape here, how the coalition can be helpful by bringing the influence and weight of prior COP presidencies in support of the current COP planning process. And of course, we know it's not just about those few days or a week in Belém, but it's the lead up to it, and it's what permanent capacity and activity streams we can launch from this platform, which is fantastic, and we've just heard about from you, Ambassador. What actually can the civil society organizations here in this room do? Maybe just we can go around, and each of you, if you could give us one action that we could take from either the private sector or the civil society. What's one thing we could do in support of the Belém Health Action Plan and do it, if possible, through the Baku Continuity Coalition? Elmar, will you respond to that first? How can we help? You're the current chair of the coalition.
Can you hear me?
Is the question?
It was to you, Elmar, but now I see that Maria maybe is back, so maybe she could respond to that. Just, Maria, I had first asked how you support low and middle income countries that are working to build the kinds of adaptation capacity that we've just touched on. And what resources do you need to do that, and how can we help?
Thank you very much. I'm hoping you will hear me. Let me be very, very short. First,
We've lost you again. So, Elmar, if I could ask you to respond.
Ghisleni was saying. You hear me now?
It's coming and going. It's coming and going. That's all right. We're running low on time, so I think maybe just to have one comment from each of you on that front, though. You're speaking to 300 eager to contribute individuals representing organizations around the world. How can we help support WHO in its role as secretariat? Elmar, you as current chair, and Ambassador Ghisleni coming in. How can we help? Elmar, what's one thing we could do?
I think that we need to take into account also limited resources and importance of mobilization of climate finance towards climate and health. I believe we need to use innovative also resources for climate finance, particularly to bring together not only donor countries, but at the same time philanthropies, private sector, and also multilateral development banks, multilateral climate funds. That's why I think that these topics of climate finance and also which we achieved on defining of this new NCQG, Bele action plan could complement it with concrete action plan. And at the same time, civil society's role is indeed very important because on the role of civil society, it could play a crucial role to bring together this demand and supply and to tackle this issue. That's why I think that in the future, because this continuity coalition just established and started to be operationalized, but I believe in coming months we can go to the next steps to implement it, particularly on mobilization of climate finance issue. And at the same time, as I mentioned, it could be organized coalition plus meetings, coalition plus with multilateral MDBs, MCFs, philanthropies, because the role of philanthropies also is important today. We can use also philanthropies for tackling of such problems. But what is the important role of the continuity coalition also is that we can complement these efforts, not to duplicate, not to compete, but to ensure complementarity and cooperation to address these issues, these gaps efficiently.
You really set us up for today's agenda so well, Mr. Mammadov. Thank you for that. So a few things I heard we can do there, but essentially advocate for increased financial resources and do it with multiple sectors and bring those into alignment. We've got a session later on efforts to harmonize investment frameworks and how we understand and prioritize where investment opportunities are, how we bring in the private sector, both philanthropic and corporate sources, and align those with the adaptation funds and the development finance institutions. And I think all of us can play a small role in doing that, in helping to align those investments. So that's wonderful for today. Ambassador, before I give you the last word, we do have one question, I think, in the back of the room with a microphone.
Yes.
Yes. Hello. Please introduce yourself and then go ahead and ask a question.
You know me, Kelly.
I can't see you very well, Lucas.
Okay. So, good morning, everyone. Bom dia a todas as pessoas que estão aqui.
Bom dia.
My name is Lucas, and it's more than a question. I just want to show my appreciation. I work for the UK government, and we are very happy to see the COP26 legacy being kept and worked by all the COP2COP coalition representatives. So thanks so much for all the effort from Dr. Neira from WHO, from Mr. Mammadov, and Dr. Dosa and Ambassador Ghisleni, and my colleagues from his team, Thais and Louis here. One of the things that we are ready to do is to really attend in person, really reinforce all the efforts this year. So in July in Brazil, we're going to have UK representatives for the Climate and Health Conference. And as the time that Ambassador Ghisleni shows how we need to consolidate and implement actions for our climate and health agenda, the UK government is ready to support, not just in policy, but to keep the motivation that Dr. Neira had said that we need to face in these tough times, okay? So thanks also, Kelly, for putting here in this room all the climate and health friends together with Carrie and team, and thanks for the event.
Thank you, Lucas, and thanks for that, because I know Helen Yaxley wanted to join this conversation and was unavailable at the last minute. So it's great to hear from COP26, sort of where it all began with the launch of Attach. Ambassador, you have the last word, and I'd love to hear from you what we should be keeping in mind today as we talk about climate finance for health and how best to prioritize, maximize, optimize those investments. What's the one thing we should keep in mind about the Bele Health Action Plan, your plans for COP30, as well as the Continuity Coalition?
I'm sorry, let me turn this on. Well, thank you for this question. Well, let me first endorse the comments made by my colleague Mammadov, and I was just going to say the same. I mean, public funds are still an issue on everybody's minds, and we are not prejudging the outcome of any future negotiation in the COPs on this issue. But complementarity is key. And additional sources of funding are key. So philanthropies and other stakeholders have a major role to play, especially when it comes to more specific kinds of help that can be provided to low and middle income countries. So that also can make a difference. But as for your question on what should we keep in mind, I believe that what the most important message is, and that this one should guide our work towards Belém and beyond Belém. Belém has to be a landmark, but not for the sake of itself. Belém has to be the beginning of a new moment in the fight against climate change. And so it has to be pursued, it has to be followed up on. So we are working to make Belém a success, but we are also looking forward to following up on it in future years. So let's stay together. We're just in the beginning of this road. Thank you.
Thank you so much. So that makes a lot of sense for us today. We'll think about Belém as an important tentpole moment to work toward, but we're really taking a longer view on the finance needs for health sector adaptation. Thank you to all of you, Ambassador Ghisleni, Mr. Elmar, Mammadov, Mazen, and Moza, thank you so much, and Dr. Maria Neira. Thanks for joining us for this sort of spontaneous conversation. We've got opportunities to catch up with you, it sounds like next month in Geneva at the World Health Assembly meetings, in July here in Brazil for an Attach gathering, and then of course in Belém in November. So best of luck to you as you continue planning. Thank you for your leadership and for the optimism and enthusiasm that you bring to the climate and health agenda. Thank you.
Thank you.